Birth control has a lot of purposes. Let's go over some of them. Birth control can help to prevent pregnancy. Birth control can help to regulate periods. So if your body does not make enough progesterone, it could mean that you have a long cycle, and that's sometimes difficult to predict periods of fertility. Also, the progesterone that is in birth control pills can help keep the lining of the uterus thinner, so that can lessen the length and severity of periods. Some birth control pills can help to reduce acne. Types of birth control that contain hormones can lower endometriosis-related pain. Well, what does endometriosis mean? Well, the uterine cells that line the uterus refer to the endometrium. When those cells grow outside of the uterus, it is referred to as endometriosis, and it can create fibrous, painful sort of tissue clumps, okay? So just like the hormones in birth control can limit the lining of buildup inside the uterus, it can limit the growth of endometriosis. Again, the hormones that are in some birth control options can provide migraine relief. The changing levels of estrogen and progesterone during the menstrual cycle can trigger migraines for some people who have uteruses. So that estrogen drop that occurs during menstruation can also trigger migraines. So some hormonal birth control methods might provide some migraine relief. Okay, the hormones in some birth control options may also help to reduce cramping. So dysmenorrhea, intense cramping during menstruation, it can inhibit some people who have periods from being able to function normally. And why does that cramping even happen? Well, there's an increase in a chemical called prostaglandin, and that prostaglandin is used to trigger muscle contractions. Why would I want to trigger muscle contractions? Well, I need the lining of the uterus to leave. Okay, so I need bleeding to happen to empty that lining of uterus to prepare for the next menstrual cycle. But if that level of prostaglandin is high, it can cause increased cramping, and some birth control options might help to alleviate that. Okay, there are some things to consider before choosing birth control. Okay, this is not an exhaustive list. I'm only talking about some things. Okay, some options of birth control protect from STIs. What's an STI? Sexually transmitted infection. And we'll have another video about that. But others may not protect against STIs at all or in lesser ways. Weight. Some hormonal birth control options are less effective for someone who weighs more than about 190 pounds. This is something that's important to talk with your doctor or medical professional that you are getting your birth control from. Some hormonal birth control options are not recommended if you have your own already pre-existing heart problems, if you tend to make blood clots, or if you have high blood pressure. So if you have heart problems, you have to be a little bit more careful in choosing a birth control option that works for you. Age. There are some birth control options that aren't recommended for someone over 35. Things to take into account. Smoking. Some hormonal birth control options are simply not recommended for someone who is a smoker, and that is primarily because the risk of blood clots increases. Estrogen. Some hormonal birth control options, not all, but some do contain estrogen. So this would not be recommended for people who have a history of breast or uterine cancer in themselves or in their family, because it could increase that risk. Again, that is not the exhaustive list of things to consider. There are other things that people might take into account, like, do I want my birth control to prevent fertilization? Do I want my birth control to prevent implantation? Does that not matter to me? These are things to consider, right? There are a lot of types of birth control, okay? And I'm going to show you one site that can help you choose the birth control method that might be right for you. Okay, so let's look right here. You can see where I am. I am at Planned Parenthood, which has a lot of good resources for information about birth control. But before I open this up, I just want to show you there are other health-related topics about birth control, about STDs. There's a lot of things, a lot of valuable resources here. So let me just click here for a second. You can see here are a huge list of birth control options, and it gives you kind of categories for them. So best at preventing pregnancy. So if you click on that, it's going to show you some ways that are best at preventing pregnancy and give you some effectiveness rates. What about if I want the best at preventing pregnancy and easiest to use? Again, you can see what your options are. All right, so what if I want something that helps with my period, but also something that prevents STDs or STIs. Most often now we refer to them as STIs, but they are the same thing. And you can see what your options are. All right, so let's go back so I can show you what I wanted to. So what is the right birth control for me? So if you click here and take the quiz, it's going to open a new site, and you click take the quiz, and it gives you a lot of things that you're going to answer. And in the end, it may help you choose what is right for you. It is always best to discuss this with your doctor, your nurse, your medical professional. But this can give you some information to go into that appointment with so you are more informed. Okay, here's kind of a general overview of how effective different types of birth control are. So I'm going to go through them based on this graphic. Some of the effectiveness is related to how well you use that method of birth control. Some of it is user error, and some is just there is no birth control that is 100% effective. Okay, that's important to understand. No matter what type of birth control you do choose, none are 100% effective. Some get very close, but none are 100% effective. So let's go through them. We're going to look at the most effective birth control options. First is a vasectomy. A vasectomy is a type of sterilization. So there is the tube called the, let's highlight it here, the vas deferens. And the vas deferens goes from this, the epididymis, that's the sperm storage. And so the sperm are going to leave the epididymis and go up the vas deferens, gather the extra fluids from the seminal vesicle, from the prostate, and then would be released through the urethra from the tip of the penis. In a vasectomy, those vas deferens are cut, okay, and tied off in some way. And what this does not prohibit someone with testicles from producing sperm. Sperm are produced, sperm are stored, but sperm cannot be released through the tip of the penis during ejaculation. Something that is important to note is after this procedure is done, there's a follow-up appointment. And at that follow-up appointment, what is required is ejaculation into a cup, and then it is tested for sperm count. If someone with testicles does not go back for that appointment, the procedure might not have been effective, and they wouldn't know. Okay, so that follow-up appointment is important. All right, when we look at tubal sterilization implant, this is a little bit less invasive because it does not require surgery, so there's no scarring, okay? But it does require going up through the vagina, through the cervix, and through the uterus, and then what you put is this little coil right here into both of the fallopian tubes. And then what happens is the body is like, what is this? And grows some tissue around it. And then effectively it blocks the fallopian tube. So eggs are still maturing, still are released from ovaries, there's still ovulation, but as the egg moves down from whichever ovary it is released from, it is unable to pass successfully through the fallopian tube um, in order for fertilization to occur. There is also tubal ligation. Okay, so this does involve some surgical scars. You can see one is sort of near the navel, and then there are a couple of, there would be a scar sort of low in the pelvic cavity. And in this case, the ends of the fallopian tube, fallopian tube would be cut, and then you can either be cauterized, tied and cut, or banded. It's also similar to the options for a vasectomy. Okay? All right, then we have the implant. Okay, this is a small plastic rod that's inserted in the skin of your upper arm. It can stay there for up to 3 years. It contains the hormone progestin, which is a synthetic form of progesterone. And it serves to help to stop ovulation, to thicken the cervical mucus so sperm just can't flow through it, and thin the uterine lining. Here's how an implant is inserted, a couple of different device options. Next, we have hormonal IUDs. So Mirena is a common brand of this. It is a progestin releasing IUD, and it can last for 3 to 5 years depending on the type or brand of the hormonal IUD. It serves the same purpose as the implant does. It thickens the mucus, stops ovulation, thins the uterine lining. Some people, though, might want a non-hormonal option. And that would be the copper releasing IUD. The most common brand is the ParaGard. It can last up to 10 years. So why does it work? Well, copper acts as a spermicide. So it keeps sperm from reaching the egg. It just kind of kills them. Now, interesting, the copper IUD is not recommended for someone who already has heavy periods because that particular IUD can actually increase bleeding during the period. Now, how is an IUD inserted? An IUD is inserted using a tenaculum, and it is an instrument that clips onto the cervix, holds it in place so that the IUD can be inserted effectively. This tool has not changed much over time, and it can be very painful. As someone who has had an IUD inserted, I can tell you I had to do some heavy labor breathing during that process. In class, we will pass around a tenaculum as we're going to watch a few clips about IUD insertion. Again, I really believe information is important. So whether or not you choose this type of birth control, information is important. Let's move on to the next level of effectiveness. So we have the combination pill. So this has progestin and estrogen. Okay? Most often, it is this type. You take 21 days of pills and then 7 days of placebo pills. During that week with the placebo pills, you will get your period. There are other variations where you take the active pills with the hormones for 84 days and then 7 days of placebo pills. This limits the number of periods that you would have to only 4 per year. There is also a variation where you could take the pills essentially 365 days and then not have your period. Okay? It works similar to any other birth control with hormones in that it can help to suppress ovulation, thicken mucus, and thin the uterine lining. Okay. Then we have the mini pill. The mini pill is progestin only. In this case, there are 28 active pills. There's no placebo. What is important for this type of pill is that it has to be taken in the same 3-hour window every day. It is relatively important for the pill also to take it around the same time every day, but the mini pill, it's a little bit more strict, okay? If you miss a pill, yes, you can take 2 pills the next day or follow your doctor's advice, the advice in the insert. However, the effectiveness of that birth control option goes down. Okay? It's part of the reason that birth control is simply not 100% effective, and no birth control option will be. Okay, there's also the shot, and it's called the Depo Shot. It's Depo-Provera. It's an intramuscular shot. Most often it's given in the butt, but there are other options, as you can see. It is progestin only. It's given every 12 to 13 weeks. If you wait longer, I think it's about 15 weeks, then you would need another birth control option. Okay. The sort of downside of Depo Shot is that it can cause bone density loss. That includes from your teeth as well as from your bones. So this birth control option is short term. I don't believe it's recommended for longer than 3 years. There were younger people who were given this shot for longer who then at very young ages were having bones that looked like the osteoporosis type of bones in much older people. So this is something that is a short-term option for birth control, and then you would need to choose something else. Okay, we have the ring. Okay, so this is a flexible ring. It has estrogen and progestin. What you would do is insert this. You can see it gets inserted into the vagina, and it again contains estrogen and progestin. You leave it in for 3 weeks, take it out for a week, get your period. Okay. There's the birth control patch, which again contains both hormones, estrogen and progestin. You would leave it on for 3 weeks, remove for a week. It's recommended that you change the location of the patch so that you avoid some skin irritation. All right, let's look at the next level of effectiveness. So we have the diaphragm. This is no hormones. It's a barrier method. You can reuse it for up to 2 years, but again, this is going to require some fitting at an office. Not every person will be able to use the same size of diaphragm. Okay, so although it does last for up to 2 years, there is some care involved with taking care of it. Also, it involves measuring. And if someone had a diaphragm and then had a pregnancy, they might need to have the size of the diaphragm adjusted. This has to be inserted before sex. Okay. Okay, then we have condoms. Condoms are a barrier method. Again, these have to be used every time that you would have sex. There are 3 main categories. There are external condoms that are worn on an erect penis. There are internal condoms that are worn inside the vagina. And there are dental dams that would cover either the vagina or the anus during oral sex. So let's look at them. All right, here's an internal condom. Okay, the internal condom is going to be inserted. The amount of material is greater than in an external condom because the internal condom has an area that's going to protect the vagina on the outside, and it's going to fit all the way up inside the vagina to the cervix. Okay, an internal condom. Then we have an external condom. All right, an external condom applied to an erect penis. It's required that you roll all the way down the penis before using an external condom. You are going to hold and from the base of the penis and remove the condom that way to keep any ejaculate inside the tip of the condom. Something that's important just in general for condom storage, storing them in a wallet, not a great idea. Temperature can affect the effectiveness of a condom. So there's some things to consider. And then we have dental dams. This is something, now a lot of these are flavored, but they would be applied over the vagina or over the anus for oral sex. You can convert a condom into a dental dam if this is something that you wanted and were not prepared with a dental. Okay. There is the sponge, okay, and the sponge contains a spermicide. All right, and it needs to be inserted before sex. It's not something that is left in for days. It says in this option, but again, you're going to check the packaging that it should not be worn for longer than 30 hours. So it is a temporary birth control option. Okay, we have a cervical cap. This would be similar to a diaphragm, okay, and there are different sizes and different types of cervical caps, but it serves a similar purpose to the diaphragm. And when inserting a diaphragm in a cervical cap, you're going to use some spermicide around the outside to provide some extra protection. All right, now let's move on to the lowest level of effectiveness. So there's fertility awareness. So that means checking your cervical mucus, looking for that stretchy consistency that indicates fertility, means ovulation. Checking your body temperature. So that means before waking, before getting out of bed, checking your temperature. It's going to kind of dip a little bit and then increase right around ovulation. Also a calendar used to track your cycle. All right. There's withdrawal method. That means pulling out before ejaculation. Spermicide, using just spermicide exclusively. Some condoms, though, do contain spermicide as an additional level of birth control. There is also emergency birth control. Why might you want emergency birth control? Your birth control method failed, so condom broke, condom came off, forgot to use a condom. You forgot to take a birth control pill. You forgot to put in your diaphragm. You forgot to use the sponge. Whatever it is, you forgot to use it. Or if there's a case that you were forced into having unprotected sex, so rape is involved. This is not an exclusive list, but these are some reasons that some people might choose an emergency contraception method. And there are options. First, you might be most familiar with this one. This is Plan B. But here's what some people do not realize. Plan B is less effective if you are over 165 pounds. Also, Plan B decreases in effectiveness the amount of time that passes from unprotected sex to taking the pill. So, it is recommended that you take it as soon as possible after having unprotected sex. In the first 3 days is ideal, although I believe you can take it up to 5 days. You don't need a prescription. It does prevent 7 out of 8 unplanned pregnancies if it is taken soon, because that effectiveness drops to 58%, so roughly, 5 out of 10 pregnancies if it's taken 48 hours after sex. So, with Plan B, important things to consider. 1, weight of the person who is taking the Plan B option. 2, how soon are you taking it? The sooner you take it, the better. Then there is Ella. Ella requires a prescription. This one is less effective if you're over 195 pounds. So you have a little bit more weight that you're allowed to have for this to be effective. This one needs to be taken up to 5 days after unprotected sex. It prevents about 6 to 7 out of 10 unplanned pregnancies. And then we have the ParaGard IUD, the copper IUD. This effectiveness does not depend on weight, but it must be taken up to 5 days after your unprotected sex. But it must be inserted at a medical office. So this is not something that you can do yourself, but it is 99% effective. It's important to note, again, no matter what type of birth control you're using, birth control that you take on a daily basis, birth control that you've decided as a more of a permanent solution, or birth control that you use every time you take sex, or emergency contraception. Nothing is 100% effective. So there is a lot to consider when choosing birth control. Cost. Do I need a prescription? What is the type? The effectiveness? How easy is it to use? How often do I have to use it? Is it preventing fertilization? Is it preventing ovulation? How is the birth control working? It is best to talk with your doctor and decide what methods will work best for you. Okay? This is just some information. I believe knowledge is important. So this provides a lot of information that you can then speak with your doctor or medical professional about and decide what is best for you. And that's birth control. I hope you learned something new today.